Hello, I'm Dr. Amy Oxentenko, a faculty member in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. I'm here today to discuss a manuscript that's been accepted in gastrointestinal endoscopy entitled Increasing Duodenal Intraepithelial Lymphocytosis Found at Upper Endoscopy, Time Trends and Associations, written by myself along with colleagues Drs. Eugenia Schmidt, Thomas Smirk, Christopher Boswell, as well as Felicity Enders. As a way of background, increased intraepithelial lymphocytosis with normal villus architecture is a nonspecific finding on duodenal biopsies. While this histologic finding is equivalent to the early grade 1 lesion of the Marsh classification of celiac disease and may be the most sensitive marker for gluten ingestion in those patients, other reported associations that we know about with this histologic finding in adults includes Helicobacter pylori infection, inflammatory bowel disease, small intestinal bacterial overgrowth, enteric infections, autoimmune diseases, and nonsteroidal anti-inflammatory drug use. Given the clinical associations that have been made with isolated increased intraepithelial lymphocytosis, which I'll also refer to as IELs, this finding can be very problematic for clinicians who need to decide how aggressive the evaluation should be for this noted histology. It was our perception that we were seeing an increased frequency of cases with this histologic finding, which led us to perform this research project. We searched our pathology database from January 1st, 2000 to December 31st, 2010 for adults who had normal villi and increased intraepithelial lymphocytes in their duodenal biopsy reports. One pathologist with an expertise in gastrointestinal pathology reviewed all cases to confirm that villus architecture was preserved and that there were greater than 30 IELs per 100 epithelial cells. The medical records were then reviewed for demographic information and for conditions associated with increased IELs. From the year 2000 to 2010, there were 15,839 duodenal biopsies obtained from adults at our institution, and 1,105, or 7% of them, had normal villus architecture with increased IELs, which was the histologic finding of interest. The mean age of patients with this pattern was 48 years, interestingly with 73% of them being female. We found a statistically significant difference in the female predominance of our study population compared to all patients who underwent small bowel biopsies at our institution during the study period. We indeed found that the incidence of this histologic finding has been increasing at our institution over time, more than tripling from 3% to 10.9% during the study period, as you can see in the noted figure. Although there was a change mid-decade in the definition of the upper limit of normal for intraepithelial lymphocytes from 40 down to 30 IELs per 100 epithelial cells, this definitional change did not make a statistically significant contribution to the observed increase. The majority of patients with the isolated increased IELs had serologic testing for celiac disease. This next figure demonstrates the diagnostic trends of those with known celiac disease, newly diagnosed celiac disease, and other non-celiac causes of increased IELs over the study period. The odds of having previously known or newly diagnosed celiac disease decreased by 0.91 and 0.90 times for each year on average, respectively, while the odds of having a diagnosis other than celiac disease to account for the increased IELs increased by 1.12 times on year on average, all of which were significant trends. Excluding patients with known celiac disease, 6.8% of all patients with increased IELs and normal villi were ultimately found to have celiac disease. We also found the frequency of NSAID use to be high, ranging from 9.1 to 21.6%. Also, the odds of NSAID use increased significantly over time for each year on average. Also, the percentage of patients with a final diagnosis of small intestinal bacterial overgrowth increased from less than 5% in the early part of the decade to 15% in 2010. The odds of having bacterial overgrowth also increased significantly for each year on average of the study period. So in summary, there's been an increased frequency over time with duodenal biopsies noting increased IELs with normal villus architecture. While the odds of having new or established celiac disease as an explanation for this finding has significantly decreased over time, it is still worth noting that 6.8% of the total patients with this isolated increased IELs were newly diagnosed with celiac disease, highlighting the importance of testing for celiac disease in patients with this histologic finding. The odds of either NSAID use or bacterial overgrowth accounting for this histologic finding has increased significantly over the study period, suggesting that NSAID use and risk factors for bacterial overgrowth should be considered in all patients with this histologic finding. So I want to personally thank the wonderful team that has helped with this project and thank the staff of Gastrointestinal Endoscopy for accepting our manuscript. We certainly hope you'll enjoy it.